We'll call this meeting to order. Please join me in the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Next item on the agenda is to approve today's agenda.
Mr. Chairman, I'll move item 3.
Second. Motion made and second. Questions or comments on today's agenda? All in favor?
Aye.
Opposed? The agenda is approved. Item number 4 is to approve the previous meeting minutes.
Mr. Chairman, I make a motion we move item number 4.
I'll second. Motion made and second. Questions or comments on last week's meeting minutes? All in favor?
Aye.
Opposed? Item 4 carries. We have no drainage claims. Item number 5 is to approve proposal from Total Animal Control Company for a 2% increase in fiscal year 2019 contract for services to control of animals in and around the rural areas of Webster County.
Mr. Chairman, I'll move item 6.
I'll second it.
We have a motion and a second. This is the same for contractor we've had in years past. They are asking for a 2% increase. Questions or comments on item number 6? All in favor?
Aye.
Opposed? The motion carries. Item 7 is to approve recommendation from Snyder and Associates Incorporated, engineer Paul Jacobson, to award the contract for the bank building skylight to Woodruff Construction LLC, Fort Dodge, Iowa, in the amount of $136,070. Project to be completed in 150 days after notice to proceed, and allow chairman to sign the contract at the appropriate time.
Mr. Chairman, I'm going to make a motion that we table item number 7 till next week.
I'll second the motion.
All in favor?
Aye.
We are tabled. Item number 8 is to receive and place on file proposal for one courthouse water softener.
Mr. Chairman, I'll move item 8.
I'll second it.
We have a motion and a second. We have proposals.
Yes.
Did you want me to go over them, Jack, or
Do they have any questions? I can.
I can read out, we don't read them out here. We have 4 proposals. The first one was from Winger, W-I-N-G-E-R, and the time clock softener was for $5,200. The metered softener for $5,900. Dan Riley Plumbing LLC, time clock softener for $5,552, and the metered softener for $6,332. Midstate Plumbing and Heating, time clock softener for $4,315, and the metered softener for $4,815. And then Riley Armstrong Plumbing for time clock softener for $2,314.72, and the metered softener for $2,893.
The metered one is one that is on demand.
Thank you.
The time clock softener is the lower of each of the two, and that's where you put the little pin out and it regenerates the same whatever day you have the pin on. The metered one, it regenerates on demand. If you're using more water, it'll automatically regenerate. If you're not using as much water, it won't regenerate on that day. So you save some there when it doesn't regenerate. Either one will work. The one we replaced at the bank is a metered one, and the remodel with LEC, they put in a metered one. They work real well. It's up to you on the two, but I would recommend the low bid.
Are they all the identical software?
Identical luxury, same model softeners.
Okay. All right, moving on to item number 9. Award low bid proposal for one courthouse water softener.
Mr. Chairman, I'll move item 9. And I recommend that we do Riley Armstrong, the metered water softener.
I'll second that.
We have a motion and a second to award the contract for one courthouse water softener to Riley Armstrong for a metered, for the price of $2,893. Is that correct?
Yes, 800, yeah.
Questions or comments? All in favor?
Aye.
Opposed? The motion carries. Item number 10 is to rescind the motion to approve bid from Carpet World in the amount of $3,545.35 on January 22nd, 2019 due to a computation error.
Chair, I make a motion, we act on item 10.
Second.
We have a motion and a second. Questions or comments? All in favor?
Aye.
Opposed? The motion carries. Item number 11 is to award the auditor's office carpet proposal to Jim's Flooring One in the amount of $3,880.
Mr. Chairman, I'll move item 11.
Second that?
Motion and a second. Green, you want to explain?
The original bid from Carpet World didn't have the shop carpet that we had originally picked out, and that was based, the bid was based on that from the other two. So when they came back with the shop carpet, then the bid was more.
Okay. Questions or comments on item number 11? Seeing none, all in favor?
Aye.
Opposed? The motion carries. Item number 12 is to approve and authorize the chair to sign final payment voucher for bridge replacement project FMCO 94-104-5594 over Gypsum Creek on 210th Street west of Paragon Avenue.
Chair, I make a motion, we act on item number 12.
Second.
We have a motion and a second. Mr. Will?
Yeah, Randy Well, Webster County Engineer. This project was left by the Iowa DOT on our behalf back in May of 17. PCI or Rhinebeck was the low bidder, and the project was completed in July of 2018, but it did have a lot of bid items, 52 bid items. PCI was prime, they had 8 subcontractors. It took a while to reconcile all the numbers and so forth, so essentially we get the final pay voucher here that needs to be approved and signed by the chair, and then the final payment will be released, and all this structure is paid out of our farm to market account. Any other questions?
Questions or comments? Seeing none, all in favor?
Aye.
Opposed? The motion carries. Item number 13 is to approve and authorize the chair to sign a contract with Fort Dodge Asphalt Company Incorporated, Fort Dodge, Iowa, for HMA resurfacing with milling, project number FMCO 94-117-5594 on P56 from the Fort Dodge city limits to C56 and on C56 from P56 to Highway 169.
Mr. Chairman, I'll move item 14.
13.
I'll second that.
Motion and a second on item number 13. Randy?
Okay, just a few more comments on that is, there were, due to the fact that it's utilizing farm to market funds, which are monitored by the DOT, the project was let on January 16th, and there were 3 bidders: Fort Dodge Asphalt, Matthew Construction, and Henningsen Construction. Fort Dodge Asphalt was a low bid, and all their numbers checked out. And their bid was within $24,000 of the county engineer's estimate. So I recommend we go ahead and approve the contract with Fort Dodge Asphalt.
Questions or comments for item number 13?
Do you have any idea when they're going to start this project?
Other than it'll be completed during construction season 2018, I think the contract says a late start date of July and 60 working days. I want to make it clear that we did put notes, special notes ahead of time in the project plans about the busyness and the girls' state softball tournament and that sort of thing. So what will happen here, I'm not, in the next 30 to 60 days or thereabouts, we will have a pre-construction conference with them, and we'll invite all the necessary parties, including the representatives from the city of Fort Dodge and the airport, and take minutes and let everybody know, and we'll release that information to the newspaper, and the work will commence sometime when the weather permits in 2018.
Thank you, Randy, I appreciate it.
Any other questions or comments for item number 13? All in favor? Opposed? The motion carries. Item number 14 is a public hearing proposed on amendment to the Webster County Urban Renewal Area set for 10:30 a.m. Shall we recess or table that until 10:30?
You can table it till 10:30 and then allow it.
Okay. I'll ask for a table on item number 14 till 10:30.
Mr. Chairman, I'll make the motion that we table item 14 until 10:30.
I'll second.
Motion is second to table item number 14. Could I have the same for item number 15?
Yes, I'll make that same motion.
I'll second that. We might as well add 16 to it too.
Yep. You just have to do them independently. All in favor?
Aye.
Opposed? And item 16.
I'll make the same motion.
I'll second.
Items 14, 15, and 16 are all tabled until 10:30 after the public hearing. It is now the citizens' opportunity to address this board with items not on the agenda. We'll get it on that. He's trying to get it connected still. Nate, is there anything? I reset the computer. I'm just waiting for it to pull up again. I shut everything down this time. Oops. Take your time and, we will let you start while he's still trying to get this to connect.
Hopefully the materials we have will be enough to follow along. Good morning. My name is Michelle Delriva. I'm the Executive Director at Community and Family Resources. I want to thank you for allowing me to present today. This morning I would like to share just a bit about our programs in our impact in Central Iowa and invite the county to support the construction of our new centralized facility. So I will be making a funding ask. For over 50 years, Community and Family Resources has been a freestanding, comprehensive substance abuse provider dedicated to providing individuals and families in Central Iowa and beyond. We were formerly known as NCARF as well as Safari, and we have a long history of helping people learn healthy behaviors, preventing addictions, and achieving improved quality of life. Addiction, just like diabetes or any other chronic recurring condition, is preventable and treatable. Our goal really is to educate the community on ways that they can prevent this type of disease, as well as to support and encourage those who have these addictions to overcome them, which in turn helps to salvage the family unit and restore lives. So our agency really looks at improving the lives of others by allowing people to overcome gambling, substance use, and mental illnesses that help them to become part of the community. So I'd like to start with a little bit about who we serve. So in fiscal year 2018, we served 2,029 clients for addiction. 33% of them were treated right here in Webster County. So as you may know, Webster County is our hub. So it's really where we started out our treatment over 50 years ago. Generally, we serve people between the ages of 18 and 64. And typically 64% of them are men and the rest are women. We're still trying to look at my PowerPoint.
Yeah, sorry.
That's all right. In fiscal year 2018, we also served 1,078 individuals for mental health services. 15% of those were treated in Webster County, which is an increase from the the year before. What we're doing currently is providing more mental health services to Webster County, primarily through our adult residential program. Because what we do find is nearly 60 to 70% of people who are coming in with substance use disorders also have a mental illness. So specifically, just to talk a little bit about the programs that we have here in Webster County, you all likely know that we operate out of 3 different locations. Our location on South 17th Street houses our residential programming for adults, which includes our crisis stabilization unit for people aged 18 and above who are exhibiting mental health symptoms that are in need of a place of respite where they have 24-hour care. This really was something that we started doing about 3 years ago when we had a need for more inpatient mental health beds. So it really is allowing folks to get treatment closer. Our detox program is one of 4 in the state of Iowa. And again, it was one of our programs we started out very early on. That program is a program that really looks at withdrawal management and helping people to really successfully get through those first several days of detoxing. One of the things we're really excited to let the counties know, as of January 1, we were granted the Iowa Provider Network Grant, or the Integrated Provider Network Grant, which now will allow funding for our medically managed inpatient detox. Thus far, to date, we've already had 6 clients who've taken advantage of that in Webster County, so we're really excited that that door is now open again, and people can come in regardless of funding stream. Our adult residential program serves people aged 18 and over. It has 50 hours of programming each and every week, so it's like a full-time job for people that are coming here for that program. We really look at helping people to understand their addiction, working with their families as well as themselves on what things they can do to overcome those addictions. Our adolescent residential program is located on the Corpus Christi campus, which is on 8th Avenue North. We serve kids ages 12 to 18, and we take kids from all over the state of Iowa. There are only 3 programs for adolescent residential program for substance abuse. So again, we're really excited that our agency is able to offer that along with all of our other services. We also operate a recovery house program out of 2 homes that we own here in town. So it's really a transitional living program for people who have chronic conditions that need long-term care, and people can stay up to a year in that program. Our programs are focused on men only at this time. Also within our Dodge location, we have an outpatient program, and that is on 31st Avenue North. And at that program, we offer outpatient evaluations for addiction, as well as substance use disorders. So we have therapists as well as counselors in that program that can assist people. One of the other exciting partnerships that we're working on is with United Community Services out of Des Moines. We will have a medication-assisted treatment program housed in that unit within the next 3 to 4 weeks. What medication-assisted treatment is for people who have opioid addictions. Many of you may think like that's not really happening here in Webster County. Like we're hearing that there's fewer deaths for opioids, and the reason that there are fewer deaths that are going on is that we've done a really great job of getting Narcan to first responders. So our prevention team will talk perhaps a little bit about that too during the presentation. Narcan is administered for people who are overdosing from opioids and helps give that 30 to 45 minutes if they can get to the hospital. So that is how we are decreasing the deaths from the opioids. In speaking with United Community Services, they're really excited about opening a program here for us because they already have nearly 40 individuals driving from the Webster County area down to Des Moines for their medication-assisted treatment. So we really are going to be able to help people locally, which we're excited about. Our prevention program also does some great work, and I'm going to ask Corey to kind of come up and talk a little bit about what our prevention services have done this year and some of the things that are yet to come.
Thank you. Well, good morning. My name is Corey Dewey, and I'm one of the prevention specialists with Community and Family Resources. So I just have a little bit of a description of what we've done in the past 6 months in services in Webster County. So if you notice here, in fiscal year 18, we provided about 438 hours of prevention services, totaling over 30,000 people served, and some of our focus was especially on prescription drug and proper disposal, making sure people are utilizing the drop-off boxes, and I'm sorry, focusing on binge drinking, providing the Too Good for Drugs and life skills curriculums in the schools that I'm sure you guys are familiar with. We also work with the Prosper team, which is a coalition here in Webster County that helps provide life skills training and strengthening families. We've offered restaurants and bars responsible beverage server training. That's something else that we're going to continue to do. Again, all free of charge, all of these services to community members. We're focusing on marijuana, THC presentations. We know that's different trends and things that we're seeing with different states making laws different, just making sure that Iowans are familiar with our laws, and also working on methamphetamine community assessment workbook. We also focus on gambling prevention. Those hours are a little bit lower than substance abuse prevention, but over 120 hours totaling and serving 861 people just in Webster County. So that's quite a lot. So doing presentations, working on newsletters, providing Money Smart to those in residential. So that is not just focused on problem gambling, but we know working on budgeting and money training, financial training, leads to gambling prevention. We also provided the Stacked Deck program for youth, which is gambling prevention for adolescents, focused on 11 to 18-year-olds, and then giving information at different community events. We also still have the Iowa Partnership for Success grant happening in Webster County. A lot of success happening there. The All-Stars curriculum in 6th grade, which is another prevention curriculum, that is in all of the Fort Dodge community schools for 6th graders, as well as Manson Northwest Webster, which of course services a lot of Webster County students. Working on policies and procedures, community events, and working on social host ordinance, educating the public about what that is and what some of the benefits could be. We also provide the Love Our Kids grant in Webster County, which is another medication safety prevention grant. And also our North Central Iowa Opioid Task Force is still going strong, so we're meeting in at our outpatient facility. So right now we're working on needs assessments, of course our task force, and then focusing on town hall on opioids, again opioids being heroin and prescription pain medication. We are dispersing lots and lots, hundreds and hundreds of drug disposal bags. So that's for those folks that might not be able to get out and put their medication in one of the permanent drop-off boxes. The disposal bags we're giving out have carbon inside of them, so you can put patches, liquids, and pills inside, and it neutralizes them, which that makes it safe to throw in the garbage and doesn't contaminate our landfills. And also, of course, providing naloxone or Narcan. Naloxone and Narcan are interchangeable names, generic and prescription. And so we are providing that training for any community group that might need it, and then with that we're also giving free Narcan. So Narcan does have a standing prescription for any resident, meaning that if anyone wanted to go get it from the pharmacy, they could go ask their pharmacist, but with our training for law enforcement, coalitions, first responders, we can actually give it to community members for free. So that's not a cost that the county doesn't have to pay for it themselves, because it is about $150, $100 to $150 per dosage. And then with our new contract, starting as of January 1st, as Michelle mentioned, it's now referred to, instead of comprehensive substance abuse, it's integrated provider network. The prevention department is going to heavily focus on our evidence-based programming, so in the school settings, doing life skills training, the Strengthening Families program, and promoting that. More needs assessment, working with health fairs, doing more trainings for the public. That also involves CEUs free of charge. And then brand new, which we're really excited about, our mental health awareness training grant, which I will have Todd explain a little bit, Todd Anderson, because he is going to be our trainer in that. But as far as the prevention department goes, we are making a funding request for $7,200 for the fiscal year 2020, and that will support prevention's staff time, supplies, and travel within Webster County. So Todd, if you want to.
Morning. Good morning. Thank you for having me as well. My name is Todd Anderson. I am a prevention specialist from Community and Family Resources. I am also the project director for the 3-year mental health awareness training or mental health first aid grant. This is a 3-year fully funded, so it is free, the trainings, as well as voluntary, but it does satisfy professional development, as well as any other kind of certification that might be employer required as well. But overall, it's about the equivalent to what we could say CPR is a common analogy anyway. As was mentioned before, mental health is usually co-occurring with chemical abuse. They're really one and the same, and what we're trying to do is foremost reduce the stigma commonly associated with mental health, just in general, especially discussing it, and hopefully that can break down some doors into remedying some chemical abuse issues and all other issues that stem from that. A little bit about myself. I do come from an education background. I was actually an instructor here at the college in town. And I can tell you, my 10 years there, I saw a lot of students struggle with mental health issues. 18-year-olds who should not be struggling at the age of 18, or at any age really, with whatever the issues may be. And as much as I could put an educational spin on something, trying to get somebody to write a proper sentence can be very difficult when they're struggling with something as significant as this. I've also experienced suicides, students directly from my classes, former students as well. It seems that something comes up every year, either at the college I used to be at or at the college, or whatever the colleges I used to be at. Again, at 18, it really shouldn't happen. So, but what should happen is more of a discussion about it, and that's really what this grant is going to try to aim for. In 3 years, we are trying some target demographics. The first couple of years, we are targeting higher education personnel, as well as public safety. That can also include any kind of county personnel. And this is really open for the public, but we do have some target demographics that then these demographics that commonly are the first contacts for people struggling with these issues, so therefore the training and the education can spread a little bit more. The second year, we are going to be targeting veterans, 18 to 22, take their lives every day, as well as the elderly we are targeting, and youth as well. So next year, or at the end of this year, I'll also be certified in youth, mental health first aid training, as well as adult year, which I will be shortly. And then the third year, fire, EMS, anybody that we did not collect the first 2 years, and again, the general public as well. So trying to reduce the stigma, trying to create conversations, and really what differs this from other awareness, if you will, is that we are actually training on how to make referrals. So anybody who may be struggling, we can actually train people on how not to only address that person, how to use the right language to get that person to open up, but also to refer appropriately that person to the professional personnel as well as services. So we are aiming for about 500 people at the end of 3 years. Hopefully we can do a lot more than that. So thank you. Thank you.
So you see our prevention department is very busy, and we have been growing tremendously over these past years. We're excited about that. Do you want I need to stop choosing something?
Could we
finish the whole presentation, but a little bit about just our economic impact. I know oftentimes people are talking about, you know, what do agencies and what do companies bring to Webster County? Currently, we have 89 employees that are employed across our 8 counties. Of those, 51 are actually employed in our Webster County area. With our new building, we will be adding in an additional 16 individuals. And when you look at Webster County, the median household income is usually around $42,000. So by adding these 16 positions, we're adding a value of $675,000 to the county of people that will be, you know, spending their dollars here in Webster County, because most of our folks live here in Webster County that work at our facility. So we're excited that we also are going to be growing our impact. So I know we've talked a little bit about our new building. Most of you may be aware it's well in the process of being built right off of Highway 169. That program is going to house all 3 of our current locations, and we'll have all of our programming within its doors. We're really excited about being able to increase capacity. So currently we have capacity for 26 individuals in our adult residential program. We typically get referrals from 15 to 20 people every single day. We know there's a shortage just because there's a mental health shortage as well as substance use. And again, 60% of our people have mental health issues. With the new building, we are going to have room for 44 individuals. Our detox program, which is really withdrawal management. I always say detox, but it's really withdrawal management. Has 9 current beds and we're moving to 13. So we're very excited about that. So to get down to the gist of what I'm asking for, is I have been going around to each of the 8 counties that we serve, and our goal is to raise $2 million for our capital campaign. Our building is a $6.5 million build, and we're asking those 8 counties together to help us raise $500,000 of those dollars. Webster County's population is about 18% of the total communities that we serve. So we are asking for 18% of the funding, which is $90,000, or a 5-year pledge, which would be $18,140. And we're asking that from the general funds to help us support our campaign. Currently, our campaign is at $876,000 of the $2 million. So this would certainly help us to move forward with that campaign. Oftentimes people ask, you know, why a capital campaign? I say, really because we are a not-for-profit. We always want to ensure that we're using our funds to the best of our ability and that we are going to be able to be here for the next 50 years. This undertaking was a huge project for CFR. The reason we did it is we knew that there was not capacity. Every single day we were turning people away from our residential programs. And we really want to be there for our community. And as we know, just what Todd had highlighted and Corey, is that these conditions are not getting less. It's growing. 1 in 5 individuals are impacted with a substance use disorder every single year. That statistic has not changed. So we really are asking you to thoughtfully look at our request. I will tell you that 5 of the counties have already committed and have actually provided us funding last year. One's in the process of considering, and then we also had the city of Fort Dodge that provided us with a $50,000 gift last year. So it is certainly something that people are coming around and helping with this project. So with that, do you guys have any questions for me?
Thank you. All right, we will open our 10:30 a.m. public hearing. Item number 14 is a public hearing on a proposed amendment to the Webster County Regional Urban Renewal Area. Do we have any questions or comments from the floor on the urban renewal amendment? Any written questions or comments? Questions or comments from the table? We are updating our urban renewal area to include Project Navy Blue, which was approved in December. This is the Crimmins Transportation Facility on Old Highway 20 or D20. We are also adding a rebate agreement with Cardale Incorporated at Iowa's Crossroads of Global Innovation. We have maps available, we put them up around here because of our issues with the screen. If anybody would like a copy of one, we'll make sure we have that available to you.
So this time we're actually amending the urban renewal plan to add, the previous ordinance to add the green, the light green in the corner. That's going to be included into the urban renewal area, and then that portion will be tipped for the green.
Correct. If there's no questions or comments, I'll close the public hearing at 10:37 a.m. We'll move on to item number 15, which is a resolution to declare the necessity and establish an urban renewal area pursuant to section 403-4 of the Code of Iowa and approve urban renewal plan amendment for the Webster County Regional Urban Renewal Area.
Mr. Chairman, I'll move item 15.
Second.
We have a motion and a second on item number 15. Do we have any questions or comments? Seeing none, all in favor? Sorry, it's a resolution, it's roll call.
Hinkle, aye.
Vote aye.
Campbell, aye. Item number 16 is to adopt the ordinance number 054, providing for the division of taxes levied on taxable property in the 2019 addition to the Webster County Regional Urban Renewal Area pursuant to section 403-19 of the Code of Iowa.
Chair, I make a motion we add item number 16.
I'll second.
We have a motion and a second on item number 16. Questions or comments? Seeing none, all in favor?
Aye. Hinkle, aye.
Vote aye.
Campbell, aye. It is now the Board of Supervisor Committee reports. Mental health has been postponed from tomorrow to next Wednesday, same location in Cedar Falls. And some of us will be attending the county supervisor training, hopefully weather permitting, Wednesday and Thursday in the morning. County attorney, anything? No. All right. That's gonna, if everybody's okay, we're gonna announce the courthouse will be closed tomorrow due to weather for the safety of our employees and their families. We want everybody to use caution and common sense, so we would ask, we've notified the state, and they have not made a determination of what they will be doing, but for the county, the courthouse, and all other buildings will be closed tomorrow.
And if the road crew needs to go out tomorrow for any reason, they will be